10 medications you never imagined could cause a heart attack. Did you know there are common medications that can drastically increase your risk of a heart attack? Are you possibly taking any of them without knowing the hidden dangers they pose to your heart? And why can these medications, often sold over the counter, become a true threat to your cardiovascular health? In this video, we will reveal which 10 medications, surprisingly, are associated with an increase in serious heart problems. But first, have you thought about the impact these medications could have on your life and long-term health? Although self-medication is common, the improper or prolonged use of certain medications can increase the risk of heart attack, especially in people who already have risk factors like high blood pressure or elevated cholesterol. So if you're taking anti-inflammatory drugs, antifungals, or even antidepressants, pay attention. Discover if your medication is on this list and what you can do to protect yourself. We'll show you safe alternatives so you can avoid these risks and maintain your well-being. Remember, your health is your most precious asset. Let's get started. Heart attacks are the leading cause of death in most countries. According to the American Heart Association, around 6 million people each year suffer a heart attack, with over 300,000 deaths, over 1,400,000 hospitalizations, and high public health costs in the United States alone. After a heart attack, there are numerous consequences that significantly affect the quality of life for all individuals involved. The most important risk factors for heart attacks are well established. Among them are diabetes, high cholesterol, obesity, smoking, and hypertension. Did you know that some medications are linked to chronic heart problems? Were you aware that certain medications should be avoided if you already have other cardiovascular risk factors, since they significantly increase your risk of heart attacks? Fatal errors when taking medications that can lead to a heart attack. When it comes to establishing the connection between medications and the risk of heart problems such as heart attacks, several considerations are crucial. A significant portion of this video will explain the specific medications involved in an increased risk of heart attacks. However, it's important to highlight the rational use of medications that we generally use for any health condition, as improper combinations or dosages can provoke harmful cardiovascular effects. In some cases, cardiovascular risk associated with medications rises because they're used in excessive doses for too long or incorrectly administered. It's also crucial to inform your doctor about all the medications you regularly take so that they can evaluate the potential for drug interactions that may impact your heart. Stay informed about side effects and detect them as soon as they begin to occur. Make sure to take your medications at the suggested times and determine the best schedule for each medication. Medication number 1, DPP-4 inhibitors, the hidden risk for diabetics. Dipeptidyl peptidase 4 enzyme inhibitors, or DPP-4 inhibitors, are commonly used to treat type 2 diabetes, effectively controlling blood glucose levels with a single daily pill. However, using these DPP-4 inhibitors may increase the risk of heart attacks since they can worsen heart failure in patients with pre-existing heart disease or arrhythmias. The FDA issued warnings over a decade ago about the risks of using this type of medication in patients with existing heart issues. Several scientific studies have demonstrated that these medications increase the number of hospitalizations and cardiac complications in patients who already had controlled heart failure before beginning these diabetes medications. A higher number of hospitalizations for heart issues were also observed in patients who had no prior heart disease. These studies were conducted with various medications using this mechanism of action and found the same adverse cardiovascular effect in all of them. Today, these medications are prescribed for diabetes only in specific cases and include routine monitoring of heart function to check for potential damage related to these medications. Medication number 2, the hidden danger of common anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, are widely used to treat pain and inflammation and are universally used across all age groups. It has been determined that these medications can increase your risk of a heart attack, as well as other cardiovascular and cerebrovascular complications. This cardiovascular risk increase is higher if the person already has a pre-existing heart condition than in healthy individuals. The main issue with non-steroidal anti-inflammatory drugs is that they are commonly used and sold over the counter worldwide. The main examples are ibuprofen, naproxen, diclofenac, ketoprofen, ketorolac, and indomethacin. The primary recommendation if you're self-medicating with any type of NSAID is to use them at a low dose for the shortest time possible. If you are taking multiple medications for other reasons or have a history of heart problems, consult your doctor before self-medicating. For short-term use and at proper doses, NSAIDs are generally quite safe and pose no cardiovascular risk or risk to your overall health. They have several minor side effects, but if used rationally and for a short period, the risk is low. In place of this type of medication, it's preferable to use acetaminophen for fever, muscle or joint pain, and inflammatory conditions until you consult your doctor. Within this group of medications is aspirin, or acetylsalicylic acid, which has an additional effect by preventing platelet aggregation and, therefore, preventing clot formation, which can help prevent heart attacks. However, only aspirin has this effect on platelets, not other non-steroidal anti-inflammatory drugs. Medication number 3. High blood pressure drugs, know which can increase heart attack risk. A recent study analyzing epidemiological data from hundreds of thousands of individuals in Europe focused on a group of antihypertensive medications and an increased risk of heart problems. These medications are the dihydropyridines, which have long been used to reduce high blood pressure and also for some cases of angina. The study specifically focused on amlodipine and nifedipine. This study included more than 10,000 people taking dihydropyridines and compared them with over 50,000 controls. The analysis conducted by the scientists linked high doses of nifedipine to a higher likelihood of causing cardiac arrest than those not taking any dihydropyridines or taking amlodipine. The group of researchers attempted to determine the cause of this epidemiological observation. Dihydropyridines act by blocking L-type calcium channels in the smooth muscle of the cardiovascular system at the heart level, altering cardiac cell function and affecting cardiac impulse transmission. This effect was more noticeable when high doses of nifedipine were used compared to amlodipine. Other studies have produced different results and have not observed this increased risk of sudden death and heart attacks in patients taking nifedipine, so this association is suspected but not entirely proven. Medication number 4. Antipsychotics, high heart attack risk in certain conditions. Antipsychotics are essential medications in treating severe mental illnesses like schizophrenia, bipolar disorder, and psychotic disorders. However, studies show that some antipsychotics, especially first-generation ones, can significantly increase the risk of heart problems, including heart attacks. Medications like haloperidol, chlorpromazine, and risperidone are associated with side effects that may impact the cardiovascular system. These drugs can alter heart rhythms, causing arrhythmias that, in severe cases, can lead to cardiac arrest. Furthermore, antipsychotics can cause weight gain, elevated cholesterol levels, and insulin resistance, contributing to type 2 diabetes and increasing the risk of heart attack. Patients with existing heart problems or risk factors are particularly vulnerable to these effects. To mitigate these risks, antipsychotic use should be carefully monitored by healthcare professionals. Dosages should be individualized, avoiding high doses or prolonged treatments without oversight. Regular tests, such as electrocardiograms and cholesterol monitoring, are crucial to reducing the risks of cardiac complications. Medication number 5. Ketoconazole, the antifungal that can affect your heart. Ketoconazole is a medication that has been used for several decades to treat fungal infections. It's an antifungal available worldwide in various forms: oral tablets, topical creams, foam for skin use, shampoo, and gel. The primary use of ketoconazole is to eliminate fungi and yeasts on the skin and in some internal organs. However, ketoconazole must be used cautiously due to its numerous side effects. In 2013, the United States Food and Drug Administration, FDA, warned about the use of oral ketoconazole tablets previously used to treat fungal infections on the nails and skin. This warning was issued after a lawsuit involving a patient's death linked to this medication. In this case, ketoconazole caused fulminant liver disease, which, combined with other interacting medications, led to irreversible health problems and ultimately death. For this reason, since 2013, the FDA has issued warnings on all oral forms of ketoconazole about the severe risks of its use without a medical prescription. Ketoconazole is now reserved for specific cases of fungal infections, not for use in skin and nail infections. For nail fungal infections, treatment with ketoconazole needs a long duration, which increases the risk of side effects and medical complications. Furthermore, safer and more effective alternatives for treating nail fungi have become available, particularly for mild to moderate infections. This antifungal is thus reserved for severe fungal infections with no alternative treatments available. Side effects include nausea, vomiting, abdominal pain, loss of appetite, jaundice or yellowing of the skin, dark urine, among others. The topical versions, used in creams, gels, or even shampoos, do not have severe liver or cardiovascular side effects like the oral ketoconazole tablets. Ketoconazole, the hidden effects no one told you about. Ketoconazole can harm your heart by altering the heart muscle's electrical conduction, encouraging complex arrhythmias that could endanger the patient's life. On an electrocardiogram, this can show as an extended QT segment due to this change in electrical activity, predisposing to severe cardiac problems. Certain medications such as dofetilide, quinidine, pimozide, cisapride, methadone, disopyramide, dronedarone, and ranolazine have a similar effect on electrical conduction and should be avoided in combination with ketoconazole to eliminate the risk of severe arrhythmias. Medication number 6. Corticosteroids, a silent bomb for the heart. Corticosteroids are powerful anti-inflammatories used to treat autoimmune, allergic, and inflammatory diseases, such as rheumatoid arthritis, asthma, lupus, and severe inflammations. However, prolonged use of corticosteroids, such as prednisone, dexamethasone, and methylprednisolone, can pose serious risks to the heart, especially in long-term treatments and at high doses. These medications promote sodium and water retention in the body, which can increase blood pressure, one of the leading causes of heart attacks. Additionally, corticosteroids can promote weight gain, elevate cholesterol and blood glucose levels, and potentially cause diabetes, all factors that increase cardiovascular disease risk. Patients needing ongoing corticosteroid treatment should be followed by cardiologists and adjust dosages to reduce these risks. Physicians may consider using the lowest possible doses and the shortest treatment duration. Preventive measures, such as a balanced diet, regular physical activity, and strict blood pressure control, can help lower the risks associated with corticosteroid use. Medication number 7. Hormone therapies. Know how they can increase your heart risk. Numerous hormone-based medications can restore specific hormones in cases of deficiency or for chronic illness treatment. One of the most widely used hormone therapies today is estrogen replacement therapy, which is used to relieve symptoms associated with menopause, such as vaginal dryness, osteoporosis, hot flashes, mood swings, and sleep disorders. In addition, there are oral contraceptives containing estrogen in combination with synthetic progestin, used not only to prevent pregnancy, but also to control certain menstrual problems, premenstrual syndrome, irregular cycles, excessive bleeding, endometriosis, and polycystic ovary syndrome. The most commonly used hormones are synthetic estrogens, estradiol, and synthetic progestin. Both contraceptive pills and estrogen replacement therapy can increase the risk of blood clot formation, raise blood pressure, and increase the risk of heart attacks and strokes. This increased risk of clot formation within blood vessels can be associated with an elevated risk of heart attacks and thromboembolic events, such as deep vein thrombosis, pulmonary embolism, and obstructive arterial disease. Medication number 8. Fluconazole, the antifungal treatment that can harm your heart. Fluconazole is available as a suspension, tablets or oral tablets, and also as an injectable form administered intravenously in healthcare settings. It is an antifungal used primarily to treat fungal infections, especially candidiasis. It is administered intravenously when there is a severe fungal infection in an internal organ. Like ketoconazole, which has a similar mechanism of action, fluconazole can also cause severe liver failure, putting the patient's life at risk, in addition to hormonal alterations and changes in heart function. This increases the risk of complex arrhythmias and sudden death. Fluconazole, in particular, has been linked to a specific arrhythmia known in cardiology as torsade de pointe, which, if not treated quickly, can lead to death. Fluconazole must be administered carefully, especially in patients with pre-existing heart problems or those taking other medications with a similar cardiac effect. It's important to monitor blood potassium levels and avoid combining it with antidepressants, antipsychotics, and other neuroleptics. Medication number 9. Stimulants. They boost your energy. But at what cost? Some psychotropic medications are used for specific disorders like attention deficit hyperactivity disorder, ADHD, narcolepsy, and certain social anxiety disorders, among others. These medications are designed to improve concentration, alertness, and energy, but they have been linked to an increased risk of heart attacks and cardiovascular problems. Although these medications primarily act on neurotransmitters in the brain, they have been found to increase the risk of heart failure due to sustained increases in blood pressure and heart rate. These medications should be strictly limited to well-diagnosed and established pathologies and with appropriate medical follow-up, allowing routine cardiac function studies to detect problems early and reduce the risk of severe complications. Medications in this group include dextroamphetamine, amphetamine, dexmethylphenidate, lisdexamfetamine, dextroamphetamine, methylphenidate, and phentermine. In 2011, the FDA issued a warning on the use of these medications and acute heart events, recommending restricted use if there are pre-existing heart problems or if changes in heart rate or blood pressure develop after starting treatment. Regardless of the patient's age and prior health status, this recommendation includes a thorough initial examination of heart function by a specialist and periodic evaluation following the beginning of treatment. Medication number 10. Antidepressants. Discover the hidden heart effects. Antidepressants are a broad group of medications primarily used for depression, anxiety disorders, panic attacks, and certain other mental health conditions, as well as chronic pain and fibromyalgia. Generally, antidepressants work by acting on chemicals in the brain called neurotransmitters, which change the transmission of signals through neurons in specific areas of the central nervous system, triggering changes in mood, energy, and mental state. There are 5 classes of antidepressants based on their mechanism of action and the neurotransmitter on which they primarily act. 1. Selective serotonin reuptake inhibitors such as fluoxetine, sertraline, citalopram, and escitalopram. 2. Serotonin and norepinephrine reuptake inhibitors like duloxetine and venlafaxine. 3. Tricyclics such as amitriptyline and clomipramine. 4. Monoamine oxidase inhibitors like phenelzine and isocarboxazide. 5. Atypical antidepressants like bupropion. Most antidepressants have negative effects on heart function, potentially causing changes in heart rate, from bradycardia to tachycardia, heart rate fluctuations with arrhythmias, an increased risk of hypertension, electrocardiogram changes, electrolyte imbalances in the blood, and changes in heart muscle contraction. All of these changes can even lead to sudden death. Although nearly all antidepressants may have some cardiovascular effect, tricyclic antidepressants are the most implicated. As newer types of antidepressants have been developed, their safety profiles have improved with fewer cardiac side effects. As you can see, there is a wide range of medications that can harm or alter heart function, especially if you already have pre-existing heart disease. Whatever the reason for taking any medication, Keep in mind that the risk of cardiovascular issues increases if multiple medications are taken simultaneously without authorized medical supervision. Stay well informed about side effects and drug interactions so that you can discuss the need to substitute some of them and improve safety with your doctor. We hope this video was helpful. If you have anything to add, please share it with us in the comments section. Like this video and share the link with your family and best friends so they also know about the 10 common medications that could cause a heart attack. If you're new to our channel, don't forget to subscribe. Follow us on all our social media platforms, which you'll find linked in the description below. Remember, life is always better when you take care of your health.